Good morning.
Good morning. Hi.
Hi, my name is Claire Kyler. I'm going to be the nurse practitioner student doing your health history assessment today.
Okay.
How are you feeling?
I'm just fine.
Okay, what brings you to the clinic today?
I'm just here for my annual exam.
Okay, sounds good. Well, let's go ahead and get started. So I'm just going to ask you a lot of health history and personal questions. Some of them are, kind of personal, but just answer to, the best of your ability.
Okay.
First of all, any drug allergies that we know
No.
about today? No drug allergies. Okay. And do you have any diagnosed medical conditions?
No.
Okay. Do you take any type of daily medication?
I just take a one-a-day multivitamin for women over 50.
Okay. Any dietary supplements or herbs or anything like
No.
that?
Mm-hmm.
Okay. All right. Have you ever had any surgeries?
I have. I had my appendix removed in 2006.
Okay.
And I had a C-section in 1994.
Okay. All right. No other surgeries besides those two?
No.
Okay. What about hospitalizations other than the C-section and the appendectomy? Any other hospitalizations for you?
No.
Okay. And how about for immunizations and vaccinations? Did you get all of your childhood vaccines?
Yes, I did.
Okay.
Yes.
Do you know if you have an up-to-date tetanus shots within the past 5 years?
Mm-hmm.
You do for sure. Okay. And then how about your flu shot? Have you gotten this year's flu
Yes,
vaccine?
Yes, I just recently did.
Okay,
Mm-hmm.
Great. And how about the shingles?
I just got that the other day as well.
Okay. All right. Sounds
the
good.
first phase of it, and then I have to go back in a few months for the second.
Okay. Sounds good. Okay. As far as, and did you have any hospitalizations or illnesses as a child at all? Did you ever have mumps, measles, chicken pox?
I think I had chicken pox,
Okay.
but I wasn't in the hospital for it.
Okay. Made a full recovery.
Yeah.
Okay.
Yeah.
All right. Sounds good. And have you ever had a blood transfusion for any reason? No blood transfusion. Okay. How about your parents? Are your parents still alive?
Yes.
Okay.
My dad is 90 and my mom is 85. And they're still in their house and they're healthy.
Okay, great. And do they have any medical problems?
They have, or they had high cholesterol when they were put on a statin.
Okay. That's all
it.
Thing.
That's
okay,
it.
So no history of cancer,
no.
Diabetes, heart attacks, strokes, nada.
No.
Okay, great. How about siblings? Do you have any siblings?
Yes, I have 2 siblings.
Okay. Do they have any medical problems at all?
No.
Okay, great. How about children? You said you mentioned you have a C-section.
Yes, so I have 2 children, 2 girls.
Any medical problems for either of them?
No, very healthy.
Okay, great. Do you smoke cigarettes at all?
No, never did.
Okay. And how about any recreational drug use?
No.
Or how about alcohol use? How much do you drink a week?
Like on the weekends, I might have 1 or 2.
1 or 2. Okay. And what would you typically drink?
Wine.
More wine. Okay. All right. Great. And you said you're really not having any symptoms today. You're feeling pretty good.
Yeah. Okay. Fine.
So have you had? I'm just going to ask you a bunch of different questions about recent health problems. Just let me know if any of these kind of pertain to you. So have you been having any dizzy or lightheaded spells, passing out unexplained?
No.
Seizure-like activity, convulsions of any sort, but headaches?
No.
Okay. What about any recent vision changes, blurred vision, seeing spots, floaters, double, anything like that?
No.
Nothing? Okay. Do you wear contacts or glasses?
Yes, I do wear contacts.
Okay. And do you see an ophthalmologist regularly for that?
Yes.
Do you know the last time you went?
Yeah, but I think it was like May. It was
okay.
Recently. Every year I go.
Okay, great. Perfect. Any nasal congestion or bleeding from the nose or anything recently? Okay. How about ears? Any pain in the ears?
No.
Swelling? Any discharges you've noticed there?
No.
Okay. How about your hearing? Are you experiencing any type of hearing loss in either ear?
No.
Okay. How about taste? Any changes in taste or swelling of the lymph nodes in here? Okay.
No.
And do you see a dentist regularly?
Yes.
And when was the last time you went and saw the dentist?
I think I was just there in July.
Okay. And did they find any problems or tell you anything?
No.
Got a clean bill of health?
Pretty healthy.
Okay.
Yep.
Wonderful. Any problems with swallowing or a sore throat ever?
I occasionally get a sore throat if I get a cold.
Okay, so it seems to be brought on with that post-nasal drip. It's just kind of brings on the sore throat.
Yeah, and
then
I just take some Advil.
Okay.
Maybe a decongestant, and I'm fine.
And that helps the symptoms. Okay.
Yeah.
And how long do you typically have that sore throat for when it does come on?
Just a couple of days.
maybe 2 days, you think?
Yeah,
Okay.
2 or 3 days.
And how many times a year would you say you're experiencing this?
Maybe once, maybe twice.
Okay. Okay. Is it pretty constant or kind of come and go for those 2 days that you do have the sore throat?
Come and go.
It's
Yeah,
come and go.
I feel like
Okay.
it depends on the epill, maybe.
Okay.
I don't know.
Are you having that symptom at all today?
No.
No. Okay, great. Okay. And you said no difficulty swallowing or anything?
No.
Okay. How about coughing? Any like chest congestion or mucus, coughing
No.
up blood,
No.
night sweats,
No.
anything like that? Okay, great. And then how about as far as heart goes? Have you ever had a heart attack or anything?
No.
Do you ever get any chest pain?
No.
What about palpitations or your heart's beating really fast, beating really slow? Ever
No.
had any of those symptoms?
No.
Okay, and then how about any symptoms like shortness of breath at night? Like, are you finding yourself having to prop yourself up on pillows to breathe at nighttime?
No.
Never
Just
had that
regular.
either. Okay.
Yeah.
Any swelling of your like ankles or your hands? No. Noticed? Okay.
No.
All right, sounds good. Any indigestion like heartburn?
No.
Okay. Or nausea, vomiting,
No.
abdominal pain or bloating?
No.
Okay.
No.
How about problems with any constipation or diarrhea?
Nope.
Neither of those. Okay. Any blood in the stools that you've noticed?
No.
No. Okay. Any dark tarry stools?
No.
Okay. Have you ever gotten an endoscopy?
No.
You've never gotten an endoscopy?
No.
Okay.
No.
Okay. We'll talk a little bit more about that at the end of today's session then. What about any like urinary problems? Any like frequency, like peeing more frequent than usual or peeing larger amounts than normal?
No.
Any burning or pressure when you pee?
No.
Nothing like that. Okay. Any lower back pain across there at all? Tenderness in that low back area? None of that. Okay. Do you see an OB-GYN regularly?
Yes.
Okay. When was the last time you went and saw her?
I go in May.
Okay. And you're still getting periods?
Yes.
Okay. When was your last period?
About a month ago.
Okay. And how long did it last?
About 5 days.
5 days. Okay. Is that pretty typical for you for a period for about 5 days?
Yes.
Okay. Great. And are you feeling you're having an excess amount of bleeding, like saturating more than a pad an hour or anything?
No.
Having excessively painful periods at all?
No.
No. Okay. And did you get a PAP when you saw your OB in May?
Yes.
Okay. What about mammogram? Does she do mammograms?
Well, she sends me to the mammogram place.
So when was that?
That was also
That
in
was
May.
also
I
May
did
too.
it.
Okay. And those were also both
They were good.
negative?
Good. Yeah.
Okay.
Yeah.
Any lumps or concerning masses in your breast that you've noticed?
No.
Okay. Any like skin discoloration or nipple discharge or anything like that?
No.
Okay. And you already said regular periods. Any like pain with intercourse or vaginal dryness or itching?
No.
None of that. Okay. All right. Great. And let's see. You already mentioned so you have 2 daughters, correct?
Mhm.
Have you ever had any other pregnancies or
No.
any miscarriages or anything?
Nope.
Okay. And both children are still healthy. Okay.
Yes.
Great. Any problems like pain in the legs at all, or swelling or unexplained like redness?
No.
Okay. Any swelling or redness of the joints at all?
No.
No. Okay. No pain there either.
Mm-mm.
Okay. Do you ever get like bad kind of like cramps when you walk long distances or anything like that?
Not really.
No. Okay. Okay. Great. How about any like recent? Do you notice that you're bruising a lot more, or any like bleeding from the gums that you've noticed?
No.
Have you ever been told you're anemic?
No.
Okay, great. Sounds good. Do you feel like anything is kind of limiting your mobility?
No.
No. Okay.
Pretty active.
Okay, you're no like back pain or
No.
Okay, great. Okay. So what do you do for a living? Do you have a job or what?
Actually, I don't.
Okay.
I recently retired
Okay.
when we moved to
Okay.
Texas.
Sounds good.
So, but I stay active
Okay.
every day.
Okay.
I belong to 2 different women organizations, and I do some philanthropy work and
Okay. Great.
golfing.
Okay, great.
Things like
So you stay active with golfing. Do you do any other like health habits like exercise or meditation or
yeah,
anything?
we belong to a gym,
Okay.
and I try to go regularly, 3 or 4 times a week,
Okay. Great.
and do weight work and cardio work.
Okay. Great. Any like meditation or anything that you do?
I've taken yoga classes. I like
Okay.
yoga classes too.
Okay. Great. How about as far as the diet goes? Do you know what you've eaten in the past 24 hours? Can you kind of take me back through
Yes.
what you've eaten?
Yesterday for lunch I had chicken salad with fruit.
Mhm.
Last night for dinner I had chicken again with broccoli and rice. And then brunch today I had an egg sandwich with tomatoes
Okay, sounds
and
good.
avocado.
Sounds
It
good.
was good.
Any cultural or spiritual, religious background or
Yeah.
affiliations that?
Yeah, we're active with our church.
Okay.
Go to church regularly, do some volunteer work with them.
Okay, great. Do you feel like you have a good kind of network there? Or just
Oh yeah,
focus
yeah.
on-
It's
Okay,
great.
great.
Mm-hmm.
And tell me about your living situation.
We're empty nesters now, but
Okay.
we have a home.
When you say we, who
I'm with my
referring to?
husband.
You and your
my
husband.
husband
Okay,
and
great.
my dog.
Okay, great.
And we have a home, a nice
Okay,
house.
single family home.
Single family
okay,
home.
and you feel safe there?
Oh,
Do you
yeah.
feel like there's any
Yeah.
barriers
Oh,
to
yeah.
getting where you need or any safety issues at
Oh
home?
no.
Okay,
We're
great. Okay, well that's wonderful. All right. Do you have any questions for me or anything?
No, not really.
Okay. I think we're just about through then. Okay, it's nice to meet you.
Okay, thank you. It's nice to meet you too.